Thank you for inviting me. I'm going to speak about the work we have been doing in our lab in Oxford for the brain imaging in the UK Biobank. And I will start with how we have produced and disseminated the main bulk of brain imaging data. As you know, probably the brain imaging protocol has been highly optimized to get the richest amount of data in the shortest amount of time possible. And thanks to that, we have good research level data from the brain, and we can investigate microstructure in the brain and also brain function. This protocol was described in Carla Miller's paper. And what we are doing with the images is we process them with a robust automated pipeline based on FSL, which is the library that we develop in our lab. And we get processed images and what we call IDPs, imaging-derived phenotypes, out of these images. IDPs are just numerical variables that describe different features of the brain that can be used by non-imaging researchers for correlational studies, such like the volume of different brain structures, the lesion load in the wet matter, or the connection strength between different regions of the brain. And we have been doing this for the last 10 years, and right now I'm working on getting the latest public release of data that will reach almost 85,000 subjects that will be available in a few months. And as I said before, what we are releasing is processed images of 6 different brain imaging modalities, and there's another one that has been added recently, and more than 4,000 IDPs and confounding variables. But we are not only generating the data, we are also curating it and giving recommendations on how to use it. For example, I spend a big chunk of my time working on quality control. And as you can see on the left, there can be many issues in the images that would impact the IDPs that we generate. So we need to check those images and be able that the data that we release is properly curated. So using machine learning, we are able to flag the problematic data sets in the brain images, and we only have to manually check a small amount of the total amount of images that we process, thanks to these ensemble of classifiers with machine learning. But we are also giving recommendations on how to use confounding variables in correlational studies. We have studied the importance of different confounding variables derived from the brain images. Everybody knows the importance of age, sex, and head size, but we are also recommending the use of metrics of motion with D-bars, or the position of the table inside the scanner, but also the acquisition time of day is another important confounder factor, or the acquisition date, or some nonlinear combinations of the confounders. And thanks to the generation of the production of this data, and also to the curation of it, we are able to perform our own research. And I'm just going to give a few examples of this. We have studied the genetic architecture of the brain. For example, in this case, this is just one of the examples that we studied. This is the IDP would be the T2 star in debutamen, which is a metric that we get from the SWI image. And we found that there are 4 genetic SNPs highly correlated with this IDP. And we can regress back those genetic SNPs, back to the brain. And we can see that each SNP affects the debutamen in different areas. So this gives us a better idea of how the genetics affect the brain. We have also studied the healthy aging of the subjects, and this is a video where you can see that with age the ventricles of the brain increase, and we have only been able to create these age-dependent atlases thanks to the rich data that we have. and we can use it to compare subjects with the average, with the atlas. But also we have created nomograms that can be used by clinicians. And for example, in this case, if a clinician knows the volume of the left hippocampus of a female patient, we know, depending on their age, the percentile in which that patient would be. This can be useful for diagnosis for clinicians. Uh, Recently, and thanks to the second imaging scans in the brain, we were able to study how a mild COVID infection would be affecting the brain. And one of the results that we found was that the olfactory regions or the limbic regions were affected by a mild COVID infection. This was published in Nature in 2022. And recently, the latest modality that was added to the protocol that I mentioned before was ASL, arterial spin labeling, and that allows us to study the cerebral blood flow. And in a study that will be published soon, we use this modality to find differences in between hypertensive patients and control, and how that condition would affect the cerebral flow or the arterial transient time. But these are just some examples of the research that can be performed, and that's just our lab, and the data is used worldwide. And that's it. Thank you for listening, and thank you to all the participants and to the people in my lab.